If you've been diagnosed with inflammatory bowel disease, that is Crohn's disease or ulcerative colitis, life does not end. The disease is manageable, it is treatable, and here is what you need to know. Hello, my name is Mr. Rajeev. I'm a consultant colorectal surgeon, and I specialize in the treatment of inflammatory bowel disease. I want to help you understand the condition and manage the symptoms. Understanding inflammatory bowel disease and managing it could save your life. Here is what you need to know. So what is inflammatory bowel disease? Inflammatory bowel disease is a group of conditions consisting of Crohn's disease and ulcerative colitis. Crohn's disease is an inflammatory bowel disease that can affect anywhere from your mouth to your back passage, any part of your gastrointestinal tract. Ulcerative colitis is an inflammatory condition that affects your colon and your rectum. What causes inflammatory bowel disease? Inflammatory bowel disease is a condition or a group of conditions that can be caused by largely unknown single etiologies. It is thought that a number of things interact to manifest in the disease. For patients, it's really important to know that IBD, inflammatory bowel disease, is very different to IBS, irritable bowel syndrome. Inflammatory bowel disease is just that. There is demonstrable inflammation on biopsies that we've taken as doctors. In irritable bowel syndrome, the symptoms can be quite similar, but they are caused by an irritant of sorts. And crucially, there is no demonstrable inflammation on the biopsies. So Crohn's disease, typically inflammation in Crohn's disease typically affects all layers of the bowel. Ulcerative colitis typically affects just the inside lining of the bowel. Don't ignore these symptoms. It could be IBD. The symptoms of inflammatory bowel disease, or IBD, can vary depending upon which part of the bowel is affected. If the large bowel or colon and rectum are affected, this could present with a change in bowel habit, diarrhea, constipation. It could present with bleeding from the back passage or pain around the back passage. In Crohn's disease, this can affect the small bowel, and this can present with more severe abdominal pain, and in severe circumstances, IBD or Crohn's disease can present with problems such as blockages, perforations, infections, and sepsis. We know that inflammatory bowel disease is also associated with other conditions. So often people with inflammatory bowel disease have problems with eye infections, eye dryness, and joint problems also. Mouth ulcers are very common in inflammatory bowel disease. Understanding the causes of IBD. Listen to this. The causes of inflammatory bowel disease are not fully understood. We know that many things play a part in ultimately developing the disease. These are genetics, autoimmune pathologies, and also environmental factors. It is likely that it's an interaction of all of these things that eventually manifests in the disease. We know that certain things can make the disease worse. Smoking is a really important risk factor in Crohn's disease. I often tell my patients smoking is like pouring gasoline on fire when it comes to Crohn's disease. Crohn's disease in smokers is so much more severe than in non-smokers. Infections can generally trigger the onset of symptoms in inflammatory bowel disease. How is inflammatory bowel disease diagnosed? Listen to this. A diagnosis of an inflammatory bowel disease is a chronic condition and a big deal. We need to get it right. So diagnosis is important. Various tests are used to diagnose inflammatory bowel disease, and these are colonoscopy. This is a test that examines the lining of your colon and your rectum. Biopsies are often taken at the time of this examination. Sometimes we're able also to examine the small bowel where it connects to your large bowel and take biopsies of this area. This again is very important in the diagnosis. In addition to this, you may also have blood tests that assess the degree of inflammation within your bowel, as well as stool tests and also imaging. Imaging can consist of CT scans or MRI scans, depending upon what is most appropriate for you as an individual. Following all of these investigations, your case will be discussed in a multidisciplinary team meeting. As inflammatory bowel disease is a chronic condition involving management from a number of specialists, namely surgeons and gastroenterologists, it is important that treatment, therapy, and support is coordinated accordingly. By and large, the mainstay of treatment for inflammatory bowel disease, especially in the early stages, is medical therapy, and this is coordinated by a gastroenterologist. There is a role for surgery, and I will discuss this if it's appropriate with you. Understanding surgical options for inflammatory bowel disease. This is what you need to know. The surgical management of inflammatory bowel disease is very complex and done by specialists such as me. We discuss and work very closely with gastroenterologists and only intervene when it's appropriate. The mainstay of inflammatory bowel disease is medical therapy. There are occasions, however, when medical therapy fails or we feel a surgery first option is appropriate. The specifics of this will be discussed with you on a case-by-case basis. There are instances when you may require surgery for inflammatory bowel disease as an emergency, and this is usually in Crohn's disease or in ulcerative colitis when medical therapies have failed or there have been complications within your bowel. Again, your specialist will discuss this with you on a case-by-case basis. Most surgery for inflammatory bowel disease can be performed by keyhole or robotic means, and this is something that I specialize in. If you're worried about your inflammatory bowel disease and think that you might need surgery or a surgical opinion, please use the link below and book a consultation.